So, as we know that the pituitary sits in a skull base in the sphenoid sinus. It sits in a place which is called as sella. And for a skull base surgeons, sella is a universe around which all the approaches move around. Now this sella is in which the pituitary is one which is sitting, and if there is an adenoma, probably predominantly a macro than a microadenoma, or a non-functioning or hypersecretory not controlled by hormones, that kind of pituitary micro or a macro adenoma, this is the one which is going to grow in size. It is going to push the pituitary. It's also going to go into a supracellular space. Now, initially in olden days, the approach was through a microscopy, but now with an endoscope, we can, with a 0-degree endoscope, we through a transsphenoidal approach, endonasal transsphenoidal approach, we can have access to the sphenoid. We'll make a sphenoid, we'll make a ostium, we'll widen the ostium, we'll drill around, and we define what is called as a medial carotico-optic recess and lateral carotico-optic recess. That's a recess which is present between the optic nerve and the internal carotid artery, where actually it forms a stalk, a bony stalk, probably a mandibular stalk, and what we say is a maxillary stalk. So there we define all these planes and we drill out the sella, we open up the pituitary, and we can remove the pituitary adenoma. So yes, a big role in pituitary adenoma treatment nowadays, where a huge exposure you can get, exposure better than a microscope through a endoscope, where we can see the pituitary in its whole extent, adenoma in its whole extent. Also, if there is supracellular tumor which is going on to the optic chiasma, or it is going much more beyond the third ventricle, we also can extend this transsphenoidal transcellular approach to a transsphenoidal transplanum, transtuberculum approach is also what we can do. Similarly, if this adenoma tries to go posterior, we can also have access to a transsuperior transclival approach. So yes, in today's times, definitely an indication for all the pituitary adenomas which can be removed endoscopic endonasally. I am Dr. Snehal Shah. I am a head and neck oncosurgeon. I am also an endoscopic skull-based surgeon. Now, coming back to the pituitary adenomas that you see, these tumors are the ones which can also extend posteriorly and which can also be removed after removing what we call as a dorsum sella. So where we take care of inferior hypophyseal arteries. For you all to watch about this, how we go about, kindly visit my site.